Okay, fine. Yeah, good morning all, and especially to all the dentists all over the globe. I am Dr. Pavitra, today's host at Dentist Channel Online. So we are the prime channel spreading all the dental news and latest events about the dentistry and dental business all around. We have conducted 700 plus live webinars till now. 40,000 plus participated certificates have been issued till now. 25 plus dental workshops have been conducted. 400 plus national and international speakers have participated on our channel. And today we are here to discuss a topic called management of general emergencies by dentist, which is out and out topic for all of the dentists here. So we have Dr. D. Vishnukant to discuss with us and provide the insight about the topic. Dr. Vishnukant is an emergency physician. He is an ardent COVID warrior with an experience of 10 years in his field. He has worked as a consultant in Yashoda Hospital, Hyderabad, and presently is associated as a consultant emergency physician at Shantiram Super Speciality Hospital, Nandyal. He is, to his credits, he has been given a certificate of appreciation from the Society of Emergency Medicine and Fortis Hospital, Mumbai, as a frontline COVID warrior. And he has been He has completed his medicine from Arupade Vidu Medical College, Pondicherry, and he has done his MBA in hospital administration and management. And also, to his credits, he has done his certificate course in cardiovascular and stroke from Public Health Foundation of India, and also certificate course in evidence-based diabetic management and pediatric advanced life support courses. So moving over to our host, our guest speaker today, I am presenting Dr. Vishnukant. Hello, doctor.
Hello. Thank you, Dr. Pavitra, for the introduction. And thanks to DentistChannel.Online for conducting this session. So, good morning, one and all, and a very warm welcome. And without any further delay, we'll start with the session. So, first responders and management of general emergency by dentist. So, let me start with the introduction. So, why do we need first responders and how do you become a first responder? And what difference do you make in the community? And what do you learn? I'll briefly explain this in the coming slides, each point. So first responder, what is a first responder? He is a torch bearer for creating awareness among common and life-threatening emergencies. He is trained in providing basic first aid, resuscitation, and activation of emergency response. He is a certified first aid and CPR provider and is a first link in the chain of survival in medical emergencies. So chain of survival is a very crucial part in a first responder. He is the first to activate the emergency system and give support. So why do we need it? So here are some statistics, like 30,000 people die of heart attack per day and approximately 12 lakh per year people die out of RTA and more than 50,000 dog bite related deaths annually worldwide. And also India is a capital for diabetes and hypertension. And this majority of the deaths and as well as disabilities can be prevented if more awareness is created and timely intervention is provided. So what difference do you make as a first responder? So basically you can save a life. be it at home or at workplace or your parents, children, friends, or a stranger, and you can prevent severe disability and you can be a hero in the community. And it may be useful to your own self. So, what do you learn? So, identifying the common and life-threatening emergencies. Identifying an emergency is the most important and a crucial step where you will get to identify what is wrong with the victim and initiating the first response in an emergency, provide first aid resuscitation as per the situation, and more importantly, what not to do in an emergency. So these are some major medical emergencies like heart attack, stroke, unconsciousness, accident, poisoning, allergic reaction, burns, and choking. And here are some minor medical emergencies like bleeding, sprain, insect bite, dog bite, minor injuries, fits, and low blood sugar. So these are the things to remember when it comes to emergencies. Always do not panic. Call for help immediately. Keep some important numbers handy and know how to access medical records, no allergies, and always have first aid kit at home and in vehicle. And one more important thing is scene safety. Whenever you are approaching a victim, verify the scene and enter, and do not be a victim yourself. So here is a first major medical emergency, heart attack. So what is a heart attack? So uh, it happens when the blood flow to the heart suddenly gets blocked, blood supply suddenly stops, and it decreases the oxygen supply, which finally leads to the muscle death. So how to identify a heart attack? So anyone with a family history of hypertension or known heart disease, a smoker, diabetic, people who are obese, and people with high cholesterol can have a heart attack. So what to do when you witness a heart attack? So you can witness a heart attack in encounter it anywhere in a workplace, in home, while traveling or in a party or a gym. You can witness a heart attack. So whenever you witness a heart attack, try to identify with the symptoms. These are the symptoms which I have present. This we seen. Chest pain is a prime and the most important symptom of all, where the patient have excruciating chest pain. The patient may just catch his chest and just lay down. And along with that, some of the symptoms include nausea, vomiting, shortness of breath, dizziness, wheezing, and sweating and anxiety. And sometimes, and most of the times, we'll be seeing the radiation of pain towards the both shoulders or left shoulder or even jaw. And this is particularly important for the dentist when any chest pain radiating to jaw should immediately seek emergency intervention. So immediately call for help if you witness someone with a chest pain with along with these symptoms, and take care of the victim. And while waiting for the help, reassure the victim, help the person to sit down, relax, rest, and try to keep calm. And if available, give aspirin, chewable aspirin. And if the patient has any medications on him, prescribed medications, if patient is carrying with him, please give it. If the patient becomes unconscious, check for response and check for pulse and begin CPR, which we'll be dealing in the later slides. So what not to do? Do not move the victim or make him anxious unnecessarily. And do not give anything to drink as he may vomit, and do not make him walk, and he must be at absolute rest. So this is a major one of the major medical emergencies, heart attack. So we'll follow with the next one. Stroke or paralysis. So it occurs when a blood vessel in the brain gets blocked or is bleeding into the brain. So timely intervention is very crucial. So within minutes, the brain cells start to die. So how to identify? This is a mnemonic which we use. Be fast, which I have given in the top. Each one has individual has a component. B for balance. If a victim is swaying towards one side, he has difficulty maintaining posture, or he has a blurred vision or blackouts or any double vision, or in the face you have difficulty in chewing or deviation of mouth towards one side, and in the arms, if any weakness in any of the limbs, if you see, you can immediately think that it is stroke or paralysis. And speech, any slurring of speech or any difficulty in speech is a symptom of stroke or the sign of stroke or paralysis. So time is very, very crucial when you encounter these things, because risk of disability decreases as any clot bursting drug are administered within 4.5 hours from the time of onset is very, very important. So again, who are at risk? So elderly people, increased blood pressure, that is hypertension, diabetics, coronary artery disease, and people with arrhythmias and history of previous stroke. So what to do when you witness a person having a stroke? Assess with the help of this mnemonic, be fast, and immediately call for help. And while waiting, assist the patient into the greatest comfortable position possible, reassure him and make victim feel safe. If you have any reach for the blanket, cover him and prevent any heat loss. And always keep observing while waiting for help, and look closely for any changes in the condition, like deterioration in a sensorium, or unconscious, or patient or victim becoming unconscious. And if possible, prevent any fall and avoid trauma. So what not to do? Do not give anything, fluids or anything to eat, as a victim may aspirate. So moving on to the next medical emergency, breathing difficulty. Breathing difficulty is a common term, and it has a wide range of presentations, like underlying life-threatening conditions like heart failure, heart attack, lung problem, sepsis, and immediately seek help when you see someone with breathing difficulty, because do not lose time, as the patient condition may deteriorate fastly. And if he is a non-asthmatic or he is carrying any drugs with him, immediately administer it. And if you are call for help and waiting, rest him, make him comfortable, provide fresh air or oxygen. So the next is altered consciousness. So it's usually drowsiness, loss of consciousness, or delirious behavior. It can be a sign of brain irritation, infection in the brain, and the most important cause is low blood glucose levels. So if handy or if in reach, check blood glucose levels and act accordingly. And it could be even presentation of stroke that we have discussed. So do not at any cost lose time. And don't think it is any psychological condition at the first. So better rule out the common causes. So next is a trauma. So trauma can be anything from cell fall at home to a road traffic accident, or while playing sports, or kids playing in the park, or it can be due to an assault. So always stop by to help the victim and immediately call for help. And if you spot any external bleeding, apply a sterile piece of cloth and stop the bleeding. And do not move the victim unnecessarily. Unless the patient has an imminent danger, move him to the safer place. And if the patient is unconscious, turn him to one side, preferably to the left side. So here are some important points regarding approaching the victim. Always, your safety is at prime importance. Do not be a victim yourself. So scene survey is of prime importance. Look out for any immediate dangers for yourself and along with the victim. And look for the cause of injury. And if it is a mass casualty, look how many victims are there. And immediately get help. Call emergency services, find info about the victim if possible, and always protect yourself. So here we come to the next injury in the trauma, which is a head injury, and it can also occur anywhere due to accidental fall at home, mostly seen in elderlies or at someone at work or kids playing outdoor or any physical assault or in a road traffic accident. So if possible, whenever if you are in the reach, try prevent fall and prevent a head injury. And if person had head injury, so look out for any headache, vomiting, seizure, any visual problems or altered mental status. So whenever you suspect or see or witness a head injury, immediately suspect that neck is also injured and stabilize the head and neck. Seek medical help immediately, and if possible, turn on side if unconscious. Okay. Do not elevate the legs in this condition because it increases the intracranial pressure and makes the condition worse. And if you suspect any fracture of skull, do not apply any pressure and do not move victim unless there is an imminent danger. And if any object is sticking in the head, do not remove it, let it be and wait for the emergency services, and do not pack ears or nose with any dressing. And also do not give anything to eat or drink as the patient may aspirate. So next is a motor vehicle accident. So stop your vehicle in a safe place. Make sure that you do not block the road or cause harm to the other fellow drivers. So if any, direct the bystanders to keep away and call emergency ambulance or highway patrol helpline immediately. If the victim is unconscious, use your hands and forearm to stabilize the head and neck. And if you see any major injuries like lacerations or any major bleedings, apply pressure with a sterile cloth and try to control the bleeding. So our next topic will be burns. So burns are many types. It may be due to some thermal burns or chemical burns and also electrical burns. So thermal burns are caused by a variety of things, mostly seen in the kitchen households and sometimes in a suicidal tendencies. So always remove the burnt log, but not that is stick to the skin, and relieve the pain by using any analgesics which are handy, and do not use any ointment or cream because it makes the condition worse. So if any chemical burns are witnessed, remove the contaminated clothing and immediately flush the chemical with large amount of water. And always do not put any ointment or cream and never use any ice cold water. Use normal temperature water. And next is electrical burns. Make sure that the scene is safe. All the main power switch lines are off, and check for airway breathing circulation. Check for spinal cord injury and treat for shock by elevating legs. So next is electrocution. It is electric burns. So do not touch any appliances or the victim unless the current is completely off. And do not ever try to remove ground wires. Do not use any objects before separating the victim from the electrical source, as those things will not help you. And power lines must be turned off before approaching the victim. If you feel any tingling sensation, please stop. It signals that you are on an energized ground. And any live powers Ask the victim not to move. Stay where he is and should only jump out of the situation if he is threatened by an explosion. So substance abuse and inhaled poisons, mostly seen when a person takes in a suicidal tendency to kill themselves, any kind of poison. It may be corrosive or it may be a petrochemical product or any rat poison. Mostly farmers are seen consuming organophosphorus poisons. So you look for abdominal pain, cramps, nausea, and vomiting, and he may have diarrhea, drowsiness, or unconsciousness. There may be burns, odor, or stains when corrosive is taken. And you need to determine the critical information like how much amount of poison a person has consumed, what is the time that has been elapsed since he has taken it. Note down the age and what was swallowed and at what time. If a corrosive or caustic material is taken, immediately dilute it with milk or water and check for airway breathing circulation often and never do not induce vomiting. So next emergency is a choking. So this is a universal choking sign. This person grabbing his neck with both his hands, mostly seen when food particles get stuck in the windpipe, and mostly it can be prevented in children by avoid playing things which can block the airway. So here's a picture of the Heimlich manual or the abdominal thrust, where you can relieve this so blocking of the airway by thrusting in the abdomen just below the xiphisternum and giving abdominal thrust. In pregnant ladies and in morbidly obese patient, you can give chest thrust. So next is the shock. Shock is a very critical condition where there is a sudden drop in the blood flow throughout the body. There are many causes for it. Maybe there may be a trauma, there may be hypovolemic shock. It may be due to heat stroke or any allergic reaction or in severe infections. So you need to look out for rapid breathing and pulse, pale or bluish skin, moist and clammy skin, where there is nausea, thirst and vomiting. The patient may be restless, anxious or weakness, unconscious when shock is severe. So immediately check for any airway blockage, breathing circulation, is there any hemorrhage or spinal cord injury. Lay the victim down to his or her back, raise the legs and prevent body heat loss by wrapping blankets and coats and etc. And is the next emergency. In the case of asthma, mostly seen due to allergies, and patient will be coughing, blue skin, and will be wheezing. If in some cases there will be audible wheeze, and the victim may not be able to complete a sentence in one go. So help the victim to take the prescribed medication if he has written, and or immediately take to the nearby hospital and double his or her fluid intake. So next emergency is fainting, mostly seen due to dehydration and heat stroke. So you look for dizziness, pale skin and sweating. So always when you witness fainting, prevent the person from falling and having a head injury. So raise the victim legs. So by doing so, it allows the blood to drain from legs to heart. Place a cool wet cloth on the forehead. If fainted, check for injuries and check for airway, breathing circulation, hemorrhage or any spinal cord injury. And next is a seizure or convergence. If the patient or victim is having a conversion, do not give anything to eat or drink. Do not hold the victim down as he may be violently jerking, may injure himself or injure the person who is trying to help. Do not throw any liquid on face. Always cushion the victim head so that he does not get his head injured. And lay the victim in recovery position, that is the left lateral position. So next is the bites and stings, most commonly seen when we go for vacations or for hiking or trekking. So any unknown insect or bees or Any scorpion stings, most of the time we look out for. So these are the symptoms and signs. Severe burning pain at the site of the bite, usually seen in bee stings and scorpion stings. Two small puncture wounds indicate that it is a snake bite. Swelling, redness, and pain around the puncture sites may be seen, and discoloration and blood-filled blisters may be seen. And the giddiness, lethargy, muscle weakness indicate that it is venomous and spreading paralysis. Bleeding from gums and dilated pupils. So always wash it with soap and water initially, cover it with sterile dressing and immediately call for help or rush the victim to the nearby hospital and immobilize the part that has been bitten or stung. So next is a dog bite. Prevention is a major key, and if a dog bite has occurred, immediately clean with soap water and reduce the chance of rabies by 60% within the first 50 minutes of bite. You can also apply any antiseptic cream and gently press over the wound with a sterile cloth to control bleeding. And seek medical attention. Ask doctor about vaccine and immunoglobulin. Do not tie any tourniquet or completely occlude the wound. So now our next emergency is a snake bite. First and foremost, do not panic in the case of snake bite and do not touch the bite site with the bare hands and move the patient to a safer area. Immobilize the area with crepe bandage and use the right approach. Right approach is reassuring the patient that he is in safe hands and uh, getting him to the hospital and treatment with the doctor, and keep the affected area lower than the heart, and do not cut or do not suck the wound, and no tourniquets must be applied, very important, and seek the medical attention for anti-snake venom or go to a center where ASV is available. Okay? And always remember the right approach, reassure the patient, immobilize the part, go to the hospital immediately and tell the doctor about the symptoms that have been developed. So heat stroke, currently this is one of the important topics. So anyone who's standing in sun for a prolonged time, maybe doing his regular work, like farmers working in a really hot sun, or somebody waiting for a bus or something. So hot skin with a high temperature, sometimes they have bizarre behavior, even seizures or unconsciousness, sometimes rapid breathing and pulse, dry or wet skin. So what to look out for? Always check for airway breathing circulation. Spray a small amount of water on the skin and fan the victim. Cover the victim with wet sheets. If possible, paste ice packs on the area and with abundant air supply, like in the armpits and groin. Keep head and shoulders slightly elevated. Give victim cold water or electrolyte solution. And most importantly, do not give any alcoholic beverages or caffeine, and no aspirin to reduce temperature. And these are some important points while moving the victim from an imminent danger to a safer area. Do not make the injury worse by moving the victim. If the victim's life is in danger, then move him to a safer area. Do not move the victim without stabilizing the injured part, and never ever leave an unconscious victim alone. So these are some emergency moves. Always pull the victim in the direction of long axis to provide protection to the spinal cord. These are some drags which are seen, shoulder drags in the first picture. You can just grab the victim around his shoulders and pull him along the long axis, or you can do the ankle drag. You can grab the victim's ankle and pull him along this long axis, or if he is on a blanket or in an area, pull him along the long axis, protecting his spinal cord. So next is the diabetic emergencies. The two things can occur: either the sugars can go low or may become high. So most of the times when patient takes overdose of any insulin, low blood sugars occur, or skips a meal or as an infection, you can see hypoglycemia. So look out for dizziness, headache, abnormal or aggressive behavior, fainting, convulsions, and the patient is hungry, where the skin is cold, pale, and sweating. And immediately, if available, give a sugar candy, place it in the mouth under the tongue. That may help. And other emergency is a diabetic coma or high blood sugar. This occurs when there is decreased level of insulin or lack of compliance to the insulin therapy. So immediately look for dry mouth, intense thirst and restlessness. There may be a breath of acetone. Maintain airway breathing circulation and immediately rush to the nearest hospital. So next is the nosebleed. You can most commonly see in young females or in the case of trauma. So always keep in sitting position to reduce the blood pressure. Keep the victim slightly head forward so that blood run out of the nose. Never put the head backwards so that the blood, if the blood goes into the stomach by swallowing, he may vomit it back. And pinch both the nostril with the thumb and the index finger pulp and steady pressure for 5 minutes. If available, apply ice packs. And if unconscious, place him victim on the one side and seek medical attention immediately. And never ever try to straighten the crooked nose, as it may increase the chance of bleeding. So next, ocular or eye emergencies. If there is any cut of the eye or lid, do not wash or apply pressure or remove any object stuff. Bandage lightly and refer immediately to emergency or eye doctor. If there are any chemical burns or light burns, use fingers to keep the eye open and flush with copious amounts of water and tell the victim to roll the eyeball and loosely bandage with cold wet dressing or place wet packs. If there is any foreign object stuck in the eye while driving or during any workplace, lift the upper eyelid, allow the object to brush off. Try flushing the object by rinsing. If object is seen, remove with a moist and sterile cloth and do not allow the victim to rub the eye. If you feel any object is embedded in the eyeball, just leave it as such and urgently, emergencyly refer him to doctor. So next are the bone, joint and muscle injuries, most commonly seen in sports and in kids while playing in the park. So what you look for any injury, site of injury and swelling and deformity. So ask the victim to rate the pain according to the pain score chart. Feel for any tenderness. The pain score includes mild, moderate and severe. Just ask victim to rate from 0 to 10, where 0 is no pain and 10 is a worst pain. 1 to 3 is mild, 4 to 7 is moderate and 7 to 9 is severe. So immediately gently move the clothing and covering of the injured area. If there are any tight clothing, just try to relieve the area. Check circulation and check sensations where the injury has occurred and stabilize the injured part in place and immediately take to the doctor. So next is the sprains. You can just remember it like rice approach. So rest, stop the movement of the injured part. Most commonly seen are the ankle sprains. So stop the movement of the injured part, apply ice packs and compress using a crepe bandage and elevate the injured area. And if any fracture is suspected, do not elevate the area. So scalp wounds most commonly seen during an assault or in a workplace, accidentally injuring the scalp. So scalp is richly vascular, so control bleeding by applying direct pressure with a sterile cloth. Keep the head and shoulders slightly elevated and do not ever remove any embedded object because it may increase the chance of bleeding, and never irrigate the wound unless and until you have a sterile water. You can do that, otherwise it may cause infections. So this is a brief outline for the victim who is conscious and is unconscious. So here, a conscious patient will communicate with you and tell his symptoms or complaints, whether he is having a chest pain, is having breathing in difficulty, he is having weakness, or his patient says he is not well. So according to the scenario, you act accordingly, give him support, reassure, and call the emergency. And if the patient is unconscious, or while waiting for the emergency or help, if the patient becomes unconscious, immediately check for pulse, check his response, and begin the CPR. These are some brief CPR skills. CAB, always check for circulation, breathing, circulation, airway, and breathing. As I said, when the patient becomes unconscious, assess the response first and immediately call for help. Check for circulation, airway, and breathing. If there is no carotid pulse, and there is no breathing, begin CPR. Till it is a basic life support. This is what is called as basic life support. Giving resuscitation, cardiopulmonary resuscitation, and waiting for help until the emergency services come and take over for the advanced cardiac life support, like giving him early defibrillation, advanced drugs, and then post cardiac support. So here I conclude my presentation. Yeah, over to you, Dr. Pavitra.
Yes, doctor. Thank you. Thank you for the presentation. Sir, there is a query from Balasubramaniam
Yeah.
asking what is ASV.
ASV is an anti-snake venom, which is administered in the case of a snake bite, which is venomous.
Yes, and there is another query from Mr. Nazia asking when people have seizures and usually they have a practice of keeping the keys in their hands. How far this is safe and it is advisable, or what do you think they should do?
While a patient has a seizure, keeping or giving them any keys or anything keeping in their hands will not prevent them from having a seizure. It is a customary thing which goes on, but it does not reduce or help anywhere in reducing the seizure. In fact, it may injure the patient or the person who is helping him.
Okay, and there is another question from Sheikh Mohammed. He asks how far it is safe to use a wooden stick when the patient is having a shock, like an electric shock case. Usually it is advised to hit the patient with a wooden stick or something wood. If you take, you are safe and the patient will get safer. So how far do you think this is applicable?
So always remember to switch off the power lines even when you are using a wooden stick or any dry wooden object. Unless and until the power lines are switched off, do not approach the victim.
Okay. Sir, how do you think a dentist can help in case of heart patients where you said there will be a pain in chest and it will be radiating to the jaw? So being the first person seeing the jaw as a dentist, how it will be helpful for us to detect a heart patient at earlier stages?
Yeah, any patient with a heart condition or existing heart condition or experiencing a chest pain, a new onset chest pain, along with the radiation to the jaw or even the teeth sometimes seen, must be referred immediately to the emergency department. So Do not ignore the small things that it may radiate to only to arms or back. It may radiate most commonly I've seen in females where there has been a chest pain associated with tooth pain or jaw pain. So never ignore the small things and immediately refer to emergency.
Sir, even in COVID, during the COVID times, when there were little emergencies like burns and cuts and wounds and everything, people could not reach the emergency services. So what do you think? How do you advise to keep handy of what all things so that they can at least save the patient till they reach the emergency services?
So it's a quite tough time dealing with emergencies in the COVID time. So as far as COVID situation is concerned, always try to have minimal personal protective equipment like a N95 mask, a pair of gloves if possible, a face shield, and try to approach and help the victim wherever possible.
Any other suggestions, sir, to keep for during any emergencies related to children and elderly people at home? Any handy tips?
So always get to know the medical records, have handy of what they are taking, what are the prescribed as they are on, and yeah, always keep a first aid kit at home handy and all the essential things in it and also in your vehicle. And always have an emergency number handy, whether it may be a 108 or any hospital emergency. So that way you can immediately recognize the emergency and take them to the hospital.
Sir, there is another question from Dr. Jamshed asking to keep a seizure patient in any particular position till they have the episode is finished. Is there any special position to be applied to the patient?
Yeah. Is the seizure patient episode goes on, always keep the patient or the victim in the recovery position. That is a left lateral, preferably the left lateral position. Like patient lying on his left side. So that would help him even if he vomits anything, it is easier to come out and even aspiration does not occur in that case.